Every single morning, you do three things that either stop your prostate from growing or speed it up twice as fast. And I am willing to bet right now you are doing all three of them wrong. My name is Dr. Max. I am a practicing urologist with 15 years under my belt. And in those 15 years, I have seen hundreds of men who could have avoided the operating table if they knew what you are about to learn in the next 10 minutes. Here is what I know for sure. 7 out of 10 men over 60 are walking around right now with an enlarged prostate. But here's the kicker. Most of them have no idea, because the prostate grows silently, month after month. No pain, no warning, until one morning you wake up and realize you no longer control the most basic function of your own body. Weak stream, 3, 4, 5 trips to the bathroom every night. That constant feeling your bladder never fully empties. And the worst part? This destroys your performance as a man, because prostate problems and bedroom problems go hand in hand. But here's the good news. Free morning habits. Free and scientifically proven. That can stop this process and even reverse it. And the first habit is so simple you will think I am joking, but it can cut your nighttime bathroom trips in half, in 1 month. So let me explain exactly what is happening inside your body right now and why your prostate is growing whether you feel it or not. Your prostate is a small gland about the size of a walnut that sits right below your bladder wrapped around your urethra. For most of your life, it just does its job quietly and you never even think about it. But after 60, your testosterone starts converting into something called DHT or dihydrotestosterone. And this is where the problem begins. DHT tells your prostate cells to multiply and grow. And this process is called benign prostatic hyperplasia or BPH. Benign means not cancer, but that does not mean it is harmless. Here are the numbers you need to understand. At 60 years old, 60% of men already have this. At 70, that jumps to 70%. At 80, almost 90% of men are dealing with an enlarged prostate. So if you're over 60 right now, the odds are extremely high that you either have it or it is developing as we speak. And here is what frustrates me after 15 years of practice. Most doctors will not tell you straight that this condition does not stay mild. It progresses month by month. First, you notice you have to push a little harder to start urinating. Then the stream gets weaker. Then you start waking up once at night, then twice, then 3, 4, 5 times. And suddenly you cannot remember the last time you slept through the night without interruption. I had a patient, 64 years old, who came to my office after suffering for 2 years with worsening symptoms. You know what he told me? He thought it was just normal aging, that everyone deals with it. By the time he walked into my office, his prostate was so enlarged we were looking at surgery. And the worst part is he could have avoided all of it if he had started 3 simple morning habits 2 years earlier. So what is the first habit? It is something you do every single morning, but I guarantee you are doing it completely wrong, and it is silently inflaming your prostate 1 glass at a time. And before you roll your eyes thinking everyone knows about drinking water, let me tell you something. Most men over 60 are hydrating in the worst possible way for their prostate, and it is destroying them 1 day at a time. Here is what I see in my practice constantly. Your sense of thirst weakens as you age, so you go hours without drinking anything. Then around 8 or 9 at night, you suddenly realize you are dehydrated, and you chug 2 or 3 glasses right before bed. You think you are catching up on fluids and being responsible. Wrong. You just guaranteed yourself a miserable night. When you do not drink enough during the day, your urine becomes concentrated, dark, thick, packed with salts and irritants. And concentrated urine inflames your prostate and irritates your bladder all day long. Think of it like pouring acid through a sensitive filter for 12 hours straight. That constant irritation makes your prostate swell up even more. A study in the Journal of Urology tracked over 2,000 men, and the results were clear. Men who drank less than 1.5 liters daily had significantly worse symptoms. Weak stream, urgency, constant nighttime trips. But when those same men changed their hydration timing, their symptoms improved dramatically in just 4 weeks. I had a patient, Robert, 67 years old, waking up 5 times every night. Exhausted, barely functional. When I asked about water, he admitted he barely drank during the day and then filled up 2 big glasses at night. We made one change. 70% of fluids before 6 p.m. taper off after dinner. Within 1 month, he was waking up once at night. His wife told me, "You gave me my husband back." This is strategic hydration. Not how much you drink, but when. Front load your water in the morning and afternoon. After 6 p.m., only sips if needed. This simple timing shift can cut your nighttime bathroom trips by 40%, almost half with one adjustment. So drink a glass of water right now while watching this. Then drink consistently until 6 p.m. Try it for 1 week. But water alone will not fix this, because there is a second morning habit that attacks prostate inflammation from a completely different angle. 15 minutes after breakfast, you need to walk. And I am not talking about jogging or running or going to a gym. Just walk for 10 to 15 minutes at a comfortable pace. That is it. Here is what happens when you do this correctly. Walking after eating opens up your blood vessels and floods your pelvic region with oxygen-rich blood. Your prostate needs constant circulation to stay healthy and reduce inflammation. Without it, everything starts to swell and compress. Think of it like an engine that overheats when the cooling system stops working. But here is the part most doctors never explain to their patients. Walking after meals directly stabilizes your blood sugar levels, and elevated blood sugar is one of the primary drivers of prostate inflammation. A study published in Diabetes and Metabolic Syndrome showed that men with poor glucose control experienced significantly faster prostate growth and worse urinary symptoms. Just 10 to 15 minutes of walking after a meal cuts down that dangerous glucose spike. You do not need special equipment or a gym membership for this. Walk around your block after breakfast and after dinner. 2 short walks per day totaling 30 minutes. That is more effective at reducing inflammation than most medications you could take. But these 2 habits work from the outside by supporting circulation and hydration. The third morning habit works from the inside by directly controlling the hormones that fuel prostate growth. And I need to warn you right now that this one is going to be controversial because it challenges what most men have been told their entire lives. The third morning habit is about intimacy, and I know this topic makes most men uncomfortable, but we need to talk about it because the medical advice you have been given for decades is incomplete. For years, doctors have told men that frequent ejaculation protects the prostate. There was even a major Harvard study that followed over 30,000 men for 2 decades and found that those who ejaculated around 21 times per month had up to 33% lower risk of prostate cancer. That study made headlines and shaped medical thinking for years. But here is what newer research shows. Not all forms of sexual activity affect your prostate the same way. Partnered intimacy and solo activity both lead to ejaculation, but their effects on your hormones and prostate health are completely different. When you engage in partnered intimacy, your body releases oxytocin, which reduces stress hormones like cortisol. Your blood circulation improves throughout the pelvic floor. Your nervous system relaxes. All of this creates an anti-inflammatory environment that protects your prostate naturally. Solo stimulation does not provide those same hormonal benefits. A study published in BJU International found that older men who relied heavily on frequent solo activity were more likely to report worse urinary symptoms than men who maintained regular partnered intimacy. Think of it this way. Partnered intimacy is like a complete workout for your entire system. Hormones, circulation, stress relief, all working together. Solo activity is more like stretching. It has its place, but it does not give you the full protective effect. I am not saying occasional solo activity is harmful. What I am saying is that quality matters more than quantity when it comes to protecting your prostate. If you have a partner, maintaining regular intimacy is one of the most natural ways to support prostate health. If you do not have a partner right now, focus on the other 2 habits and talk to your doctor about pelvic floor exercises that improve circulation. So here is what ties these 3 morning habits together and why they work so powerfully as a complete system. Strategic hydration keeps your urine diluted and prevents constant irritation that inflames your prostate throughout the day. Post-meal walking floods your pelvic region with oxygen-rich blood and stabilizes blood sugar, which directly controls inflammation. Quality intimacy balances your stress hormones and creates the anti-inflammatory environment your prostate needs to stay healthy. Notice something important here. None of these habits work by themselves at maximum effectiveness. Hydration without movement means poor circulation. Movement without proper hydration means concentrated urine is still irritating your prostate. Intimacy without the foundation of circulation and reduced inflammation will not give you the full protective effect. They work together. They amplify each other. Think of it like a 3-legged stool. Remove one leg, and the whole thing becomes unstable. Use all three, and you build a solid foundation that protects your prostate naturally. But here is the critical mistake most men make when they try to implement these habits. They try to change everything overnight. They fail within a week and then give up completely thinking the right approach. Do not try to change all three habits at once because you will fail and then you will give up thinking nothing works. Start with one habit. Master it for 2 weeks. Then add the second. 2 more weeks. Then add the third. Start with strategic hydration because it is the easiest. 70% of your water before 6 p.m. Do that for 2 weeks until it becomes automatic. Then add the post-meal walks. 10 minutes after breakfast and dinner. 2 more weeks. Then focus on quality intimacy if you have a partner. Let me give you realistic expectations. You will not see dramatic changes overnight. But in 4 to 6 weeks, you will notice you are waking up less at night. Your stream will be stronger. Your energy will come back. And in 3 months, you will feel like yourself again. Now write in the comments which habit you are starting with today. Hydration, walking, or intimacy. Your answer might motivate another man to take action. If this video helped you, hit the like button and subscribe because I make videos like this every week with real medical advice you can actually use. And one more thing, this video is educational. It does not replace seeing your doctor. If you have pain, blood in your urine, or symptoms that worry you, do not wait. Go see a urologist. Get checked. Early detection saves lives. Take care of yourself. You are worth it.